My name is David Wilkins. I'm a reader in social work from Cardiff University. I am very pleased to welcome you all this morning to this ExChange webinar on domestic abuse. We're very fortunate, I think, to have with us this morning Wendy Himblett and Sophie Bell, who are both from the NSPCC, and they're going to be talking to us about the impact of domestic abuse on children, the different experiences that children can have from pre-birth up to 18, and how we can support children to recover once they're safe and no longer at risk of experiencing domestic abuse. So a little bit about our two presenters. So Wendy has been at the NSPCC for more than 7 years. She's currently responsible for scaling up the NSPCC's domestic abuse recovery programme across the UK with different local authorities, partnerships and with charities. She's also worked in the school service, focusing on safeguarding and empowering children and young people to help them recognise and speak out about any abuse that they may be experiencing, and as a childline counsellor during the pandemic, which I imagine was a very testing time for many and a very busy time on the phone line. Sophie has been at the NSPCC for 12 years, not that it's a competition, but slightly longer than Wendy. She began in the role of practitioner, working directly with families experiencing a range of adversities, including domestic abuse, but also substance misuse, neglect, and so on. For the past few years, Sophie's been developing and implementing a range of evidence-based services provided by the NSPCC, including the Domestic Abuse Recovering Together programme that I mentioned earlier. So in a very short amount of time, I'm going to hand over to Sophie and Wendy, and they're going to take us through the webinar this morning. There is a break, short comfort break built into the agenda around about 11 o'clock. Don't hold me to the time exactly, but around about 11 o'clock, you'll get a short comfort break. There's also going to be a breakout room activity, and there will be time for questions, Q&A at the end, finishing by midday. Last thing from me, there will then be a poll at the end on behalf of ExChange, just to get your feedback on the session. Always helpful for us to know what's working well, and if there's anything we could do to make our content and our webinars even more useful for you. So please do fill in that poll at the end before you leave. I'm sure you've all got very busy days. Great to see so many people here, and with that, I am going to hand over to Sophie and Wendy. So welcome to you both. Thank you for being here, and looking forward to your webinar this morning.
Thanks very much, David. Okay, so the first thing we're going to start with this morning is a health warning, which is one of the things we do with all of the subjects that we talk about at the NSPCC, but I think for many, domestic abuse is one of the more difficult subjects to hear about and listen to. If you are experiencing any difficulties having heard some of the things that we've said, if this resonates with you, if you feel that you need some support, there are some support numbers and contact details on here for the NSPCC, and also Live Fear Free helpline, which is specifically for Welsh colleagues. So please do take a note of those numbers if you want to now. They are available online as well, and we will cover support numbers again at the end as well. But just to say, be kind to yourselves. If you need to speak to somebody after this, please do reach out to some of the support lines that we'll talk about at the end. Okay.
Great. Hi, everyone. Right, so we're going to start just with what is domestic abuse. And this information has been taken directly from the Welsh Government website. So domestic abuse is any incident or pattern of incidents of controlling, coercive or threatening behaviour, violence or abuse between those aged 16 or over who are or have been intimate partners or family members, regardless of gender or sexuality. There are many different forms of domestic abuse. These include, but are not limited to, coercively controlling behaviour, emotional or psychological abuse, physical abuse, sexual abuse, financial abuse, harassment and stalking. Domestic abuse may also include a range of behaviours that, when viewed as isolated incidents, do not seem much. If they involve a pattern of behaviour that results in you feeling fear, alarm or distress, then it is abuse. As you are probably aware, the Domestic Abuse Act of April 2021 was the first time that children are actually recognised as victims of domestic abuse in their own right if they had seen, heard, or experienced any form of domestic abuse. This obviously was a very positive move from the NSPCC's point of view.
And as I covered in the previous slide around the health warning, it may be that somebody you know or somebody or even yourself is experiencing domestic abuse. Domestic abuse often includes coercive control, and victims can experience isolation and control in terms of who they talk to and what they talk about or disclose. It's really important to understand that for victims to feel safe, they are offered the opportunity to meet at a time and place that doesn't increase the risk for them. What we know about victims of domestic abuse is that they will only disclose if they feel that the person they're going to disclose to can make the situation better. If there's any risk in there, if there's any doubt in their mind that that might make the situation worse, they don't disclose. So we need to offer them a safe space to talk to us. So just briefly to cover, if somebody does disclose to you, whether that's an adult or a child, listen to them carefully. Make sure they understand that they've done the right thing by telling you their experience, and reiterate that it's not their fault. Ensure they understand that you're taking them seriously. Never confront the alleged abuser, that's really dangerous, and explain to them what you'll do next so that they understand the next steps that you're going to take once they've made that disclosure. The next step should be to seek professional help to safeguard the victim or victims if there's more than one. Explain that you need to tell someone else who can help. Offer them childline and helpline contact details. They can contact them for support themselves, or any other local support services that you're aware of that are domestic abuse support services. Always be careful about making promises to keep information a secret. Sometimes as professionals we have to share that information to make sure that families are kept safe. And where there's a risk of immediate danger, call 999 and ask for the police if you feel that there's an incident that is resulting in immediate danger. Okay, we will start to run through the answers now. So question 1, according to the Children's Commissioner for England and Wales, how many children are estimated to be living in homes where domestic abuse is a factor? So the most popular answer here was 200,000. The correct answer is 830,000. It's a really, really significant number. So not far short of 1 million children are estimated to be living in homes where domestic abuse is a factor. So it's really, really significant that we understand the impact for all of those children. So question number 2, according to Refuge, between 2005 and 2015, how many children were killed by violent fathers who'd been allowed to see their children through formal and informal child contact arrangements? So this was post-separation. The most popular answer there was 12. The right answer was 19. So 19 children in the space of 10 years. And that was 19 children from 12 different families, so some of those were siblings. Question 3, according to the NSPCC figures in 2011, which obviously now is 11 years ago, how many babies under the age of 1 year were estimated to live with domestic abuse in the UK? And as it says domestic violence, just to point out, kind of the language has changed quite a lot over the last 10 years, and we now tend to refer to it more as domestic abuse because of the kind of limitations that are suggested by the term domestic violence. And we know that with a lot of coercive control, there is no violence there, it's more the threat of and the controlling behaviours. The most popular answer there was 19,000, and the correct answer was 39,000. And that was 10 years ago, and we know that in terms of statistics there hasn't been a significant change, and certainly not a reduction in the prevalence of domestic abuse. If anything, we believe, particularly since the pandemic, that there's been quite a significant increase, so most likely that number would have increased as well. In the 2020 Child Safeguarding Practice Review Panel's annual report, and so that used to be the Serious Case Review Panel, They're now called the Child Safeguarding Practice Review Panel. What percentage of the serious incidents reported to the panel featured domestic abuse as a factor? The most popular answer there was 40%, and the correct answer was 40%. So almost half of all serious incidents that were reported to that panel that featured harm to a child featured domestic abuse as an incident, or as a factor, sorry. So really, really significant links there between domestic abuse within a relationship and harm to children. Okay, so we're going to move on now. If the poll doesn't disappear from your screen, you should just be able to click in the cross in the top right hand corner to move that away.
Yeah, so as we've already shown from that information, the studies that we did 11 years ago, as Sophie quite rightly said that we estimated around 1 in 5 children experienced domestic abuse. Sadly, we know that during the pandemic, there was a significant increase. And we know that because of the increase in contacts to our adult helpline, who actually responded to over 11,600 contacts about domestic abuse in 2020, 2021, which was a 35% increase on the previous year. Currently, we also know that our helpline is receiving an average of over 30 contacts a day, and that's by phone, email, from adults who are worried about children who are living at this moment with domestic abuse.
So again, just to mention the pandemic, because we know that there was a really significant increase in reports of domestic abuse during that time. Between the 23rd of March and 17th of May 2020, the NSPCC helpline received 1,500 contacts from adults who were worried about the impact of domestic abuse on children. And Childline delivered over 500 counselling sessions to children and young people who were worried about domestic abuse. The key themes of the contacts that we received, both at the helpline and Childline, included reduced access to support networks, lockdown bringing domestic abuse into a sharp focus, making it harder to speak out, that finding those safe spaces were much more difficult in the pandemic when people weren't allowed to, leave their home so much and have face-to-face meetings with people. The difficulties of online meetings with professionals if you're living with a perpetrator were really significant. Making it more difficult to leave that relationship, an increase of drinking alcohol during lockdown, exploiting fears about the coronavirus, so as part of that coercive control, very often playing on those fears. And young people were worried about other family members as well. And if you just want to take a moment to read these 2 quotes, so the top one was from a 14-year-old who contacted Childline, and the bottom one was from a neighbour who contacted the NSPCC helpline. I'll let you take a moment to read those. And I think if we imagine for children who previously would have had school as a safe space to turn to if they were living with domestic abuse, lockdown took that away for them. They were having to live in that home 24 hours a day, and they didn't have that safe space. They didn't have that escape to go to school with people who made them feel safe. And again, for neighbours where people began working from home more, tended to notice those incidents happening more and more. And again, for victims, if the perpetrator previously was going out to work and then began working from home or lost their job, again, that really intensifies the situation for them during the pandemic. And I think it's something that we can't shy away from. And many people have never returned to the office. So again, that might be something that is significant for families going forward, that they don't have that safe space now. The victim maybe doesn't go out to work anymore, or the perpetrator doesn't, and so they're together all of the time. Okay, so going back more generally now to thinking about witnessing and experiencing domestic abuse, and we know, as Wendy pointed out, that children are victims and are thankfully now recognised as such in their own right. So children never just witness domestic abuse, it always has an impact on them. Exposure to domestic abuse or violence in childhood is child abuse in itself, and thankfully is now recognised as such in terms of children being victims. Children's experiences are unique and vary depending on the context in which they live, and I can't press that point enough. So no child will experience domestic abuse the same as another child. Everyone's experience is unique. The impact is unique as well. So we can't say that if a child experiences X, the results and the trauma will be Y. It will be different for every child, but there are some common themes that we can recognise and we can pull out that say, if a child was to experience this, they may then result in this, this and this. So children may experience domestic abuse directly, but they can also experience it indirectly by hearing the abuse from another room, which is incredibly powerful for a child who children tend to have much more vivid imaginations than adults. And so if they can just hear what's happening, there will be a picture in their head that's going with that very often will be worse than what's actually happening. So incredibly scary for children who are left in another room, often in bed, and parents will think they're asleep. They'll see their parents' injuries or distress afterwards. Very often there'll be broken furniture or damage to the property in terms of holes in doors or walls. Being hurt from being nearby or trying to stop the abuse, particularly if we think about babies being in mum's arms, if an incident happened. And I will say as well, I very often speak about being in mum's arms rather than being in father's arms, and we have to recognise that males are also victims of domestic abuse. But the service that we run at the NSPCC is for mothers only. We will talk about that a little bit more later. So please do excuse me if I slip into that, because I very often talk about domestic abuse within that context of our domestic abuse recovering together, where women are victims. But absolutely, we understand that males are victims of domestic abuse as well. And experiencing a reduced quality in parenting as a result of the abuse. We know that living with domestic abuse and being a victim of domestic abuse takes an incredible amount of emotional toll on a person, and so that emotional availability of a parent, if they're experiencing domestic abuse, is significantly reduced. So being there for their child, the emotional regulation and that co-regulation that children really need can often be reduced as a result of that, and they don't get that quality interaction from their parents that we would want to see very often. And as I say, everyone's experience is unique, so it's not to say that every child living in that situation would experience those things. Okay, so why should we be worried? Experiencing domestic abuse is a form of abuse itself, and living with it can have a really profound impact on a child's development, their health and their well-being. And that's physical health and emotional health, which is why we talk about well-being specifically. It can also damage the relationship that a child has with their abused parent, so the victim survivor, if the relationship's ended. Their experiences are connected but unique in the way that it makes sense to them. So both the adult victim in the relationship and the child is they're both victims, but the way that they experience that relationship and the way that they make sense of that is often very different, and we'll come on to that again when we talk about the DART programme that we run at the NSPCC, because what's really common is that children and parents very often don't understand that their experiences have been processed differently. The effects of domestic abuse can persist into adolescence and adulthood with significant costs for society as a whole. So even if that domestic abuse relationship ended when the child was just a baby, that impact, if the trauma isn't supported in a way to overcome those difficulties, can then still persist into adolescence and adulthood. And domestic abuse, as I mentioned earlier, was a feature in 40% of serious incidents reported to the Child Safeguarding Review Practice Panel in 2020. So it is a really big concern for children in the UK. So what we're going to do now is I'll hand over to Wendy for this one, I think.
Yeah, okay. Taking myself off mute, which was a good start. Right, so what we'd like you to do now, we're going to set up some breakout rooms. And what we want you to have a think about together is, how does domestic abuse impact on a child? So we want you to have a bit of a discussion about what their actual kind of their lived experience, once I get my words out, is like compared to children who don't experience domestic abuse. And what we'd also like you to do is just think of a couple of key points that you've agreed on, and agree for one person in each group to share those with us. And you can do that by typing in the chat when you come back to the main room.
So the first question was, what might their lived experience be like compared to children who don't experience domestic abuse? And the second question is, the first one was, how does it impact on a child? And the second one was, what might their lived experience be like? So in terms of impact, we've got learnt behaviours to keep themselves safe at home and hypervigilance outside of the home, absolutely, yeah. And so things like trauma and ACEs have a knock-on effect on the child and for society, education, development, mental health and self-esteem, absolutely, on all aspects of their life. Siblings dynamics, cannot make presumptions about a sibling group, but have to make an assessment for each child, absolutely, because each child's experience is unique and each child will have likely played a different part within that family dynamic. So some children are used to be brought on side with the perpetrator, and other children are treated much more as a victim of the abuse than kind of to join in as part of the perpetration. Very often it depends on age and gender of the children as to who experiences what within that relationship. Child may remove themselves from the situation and try to intervene, may not want to attend school, may display certain behaviours such as bedwetting, things out of character, challenging, or may copy perpetrators' behaviours, may be quiet or withdrawn, or the opposite. And that's absolutely the case. So some children will be really withdrawn, some children will be display some really overt challenging behaviours that are really very obvious, and very often historically in assessments, those children who had the challenging behaviours were seen as more in need of services or more impacted than the children who were quiet and withdrawn, and we know that that's absolutely not the case. May become involved in antisocial or risky behaviours, leading on to involvement in criminal and sexual exploitation, substance misuse. Alternatively, the child may present as very quiet and compliant. Normalisation of domestic abuse behaviours. Sorry,
it's a bit on with second. Yeah. Here on.
I can't hear you very well. Sorry, Kate. Is it Kate or Debbie talking? Not sure.
Is for the second question.
Not sure if it's me. Am I okay, Wendy?
No, I can't hear either. Sounds like a Dalek.
Sorry, Debbie, we can't hear you. I don't know if you want to pop another.
The normalisation onwards is for the second point, second question.
Yeah. Okay, that's fine. Thank you.
Right.
Caring role, no time to be a child and take part in social activities. Impact of living in fear. Sorry, I've just slipped up there. Sorry, my chat's frozen a little bit. Okay, so we've got group 4, mental health and well-being, which absolutely, so that's one of the big common things that people have pulled out. Difficulty to trust others, especially adults, and that makes it incredibly difficult for children to then disclose. Thinking about the way that children develop different relationships, feel neglected and have difficulties in developing relationships, and very often do experience neglect, both emotional and physical neglect, as part of the domestic abuse for various reasons. Early brain development and brain architecture, absolutely, and we come on to that as well. It can have a significant impact on that. The impact on brain development of babies, early development, and in particular normalising the behaviour of domestic violence and abuse. Yeah, absolutely. Okay. Wendy, did you spot anything key that I've missed out there? Because I know my chat skipped a little bit, but there's some key themes there, particularly around children's behaviours very often either being displayed as very challenging or quiet and withdrawn, and the impact on their physical and emotional well-being quite significant as well.
Yeah.
And the impact of trauma. Absolutely. So you've pulled out some really, really fantastic points there. And we will go into those in a little bit more detail after the break. I will say that the domestic abuse and the impact on children could easily be a 2 full-day course, if not a week-long course. So this is very much a whistle-stop tour that we'll go through after the break. But there are lots of sources that you can find via an SPCC learning website with different links and things, so do access that, and we will refer to some of those as well. And I know Wendy's got a link to share in the chat later on. Yeah. So it will be a very brief kind of bullet point tour in the next hour after the break. Okay, welcome back everybody. So what we're going to do now is just have a look at some of the key things that we know children can experience, some of the impacts that we know they can experience. And as I said earlier, every child's experience will be unique, and the impact that their experience has will therefore be unique. But we do know that there are some commonly identified impacts on children. So thinking about physical and developmental impacts, higher rates of illness and fatigue can be an issue. Reduced physical growth can be an issue. Physical injuries can occur if a child gets caught up in a physical incident. We know with the higher rates of illness and fatigue that a lot of that is related to the fact that not only do they not sleep very well, but if they're under high levels of stress and there's that kind of ongoing release of cortisol, it can cause issues with illness and fatigue as well. It can impact on their immune system and all sorts of other things. It can have a real impact. We know that there can be developmental delays for lots and lots of reasons. Thinking about one of the things we talk about a bit later on this morning is the impact of development in the impact of domestic abuse in the perinatal period. So thinking antenatally before that baby's even born, there's quite a significant impact on brain development, and brain development was identified by some of you in your breakout rooms. So we do often see developmental delays for children who have been living with domestic abuse, and we know that domestic abuse doesn't always occur in isolation either. There tends to be a combination of issues, and domestic abuse is one of those. Neglect very often is another one of those. Trauma impacts on brain development, and this is really, really significant. One of the things that I want to share with you in the chat now is a link to the UK Trauma Council. They've created a guide sharing research into how people's brain changes following trauma, and how that can affect a child's social world. So the guide illustrates the importance of social relationships for mental health and explains that children with a history of maltreatment, which includes domestic abuse, could face social difficulties such as bullying. And there's some recommendations in there as well. So I'm just going to pop that link in the chat with a bit of blurb that goes before that to explain what it is. So that might be of interest to you. It's not domestic abuse specific, that's trauma specific. So it is wider than domestic abuse, but is related to the subject matter. And it can also impact on the nervous and hormonal systems as well. So it's important to understand that. And we may see some of those issues for children living with domestic abuse. So some of these behaviours or things that we may see, and a lot of these were identified already within your feedback from your breakout rooms. So children might feel anxious or depressed. They might have difficulty sleeping. They might experience nightmares or flashbacks. They may be easily startled. Physical symptoms like tummy aches, or they might start to wet the bed. And I know they were mentioned in the chat earlier from feedback from your breakout rooms. Temper tantrums and problems at school. So children who are experiencing domestic abuse and have lived with domestic abuse may not know how to behave in a socially acceptable way. They may behave as though they're much younger than they are. Equally, they might behave much older than they are if they're taking on caring responsibilities as well. We may see aggressive behaviours, or they might internalise their distress and withdraw from other people. They might have a lowered sense of self-worth. Older children might begin to play truant, and again, this was another thing that was identified in the feedback from the breakout room. So things like using alcohol or drugs, begin to self-harm, taking overdose, cutting themselves, or having an eating disorder. They might feel angry, guilty, insecure, alone, frightened, powerless, or confused. And we may also see some ambivalent feelings towards the abuser and the non-abusing parents. So they might feel confused about how to feel about that person, or they may have shut down and just feel very ambivalent. Kate, did you have something you wanted to raise? Oh, no, okay. Apologies, that was, I don't know, it appeared that there was the white hand over you, but I think that may well have been my cursor, so apologies for that. So domestic abuse and the impact on children and young people's mental health and emotional well-being. So the previous slide looked at some physical things that we might notice, but also some of those feelings and those relationship behaviours. So we know that children, and for any person who witnesses domestic abuse, the fight or flight response may be activated. And this can result in the release of cortisol and adrenaline, as I mentioned cortisol earlier. And while this is a neurological function designed to keep us alert and alive during times of danger or crisis, where this is repeatedly activated, it can damage a child's brain and is related to the related bodily functions. So what we say here is, if you think about a time where you've been afraid, your focus becomes on running or staying still or screaming or hiding, and you're not able to focus on anything else. Is that any better? I think there's been a bit of an issue with sound. Can everybody hear me okay?
Yeah, I can hear you okay. Just a little bit of air popping. So yeah, if you just try and move the mic a little further away, it should clear that up.
Okay.
We'll try that.
That'll work.
Thank you.
And this can cause deficits in emotional regulation, in working memory, in problem solving, in communication skills, in behavioural self-control, self-esteem, and impulse control. And if we think about those things that I've just read out there, all of those are key life skills. They're important for children to be able to function in school and in their day-to-day life in society. And if children have had significant deficits around all of those things, it will significantly impact on their life chances. Many of these features are often misconstrued by adults as bad, disruptive, and naughty. The experience of trauma could inhibit a child's ability to learn, to be calm, to regulate, and to understand the world around them. Children whose brains are not fully formed are not equipped to understand, rationalise, or articulate the trauma they have experienced within domestic abuse. So children living with domestic abuse need some support to overcome and recover from their experiences, because every child living with domestic abuse will be impacted in some way. The level of impact will differ for each child, but we do need to recognise that this is an unmet need. This is a trauma response. This is not naughty behaviour. This is about their ability to function in the way that society wants them to function, and the impact that the domestic abuse has had on them being able to do so. So we know that domestic abuse impacts on a baby before it's even born if domestic abuse is happening during pregnancy. When we talk about the perinatal period, that's from conception up to 1 year in the UK generally. There are different timeframes outside the UK, but particularly within the NSPCC and generally UK-wide. When we see the term perinatal, that means from the point of conception up to the baby's first birthday. And we know that safeguarding concerns generally don't start post-birth. We need to be confident that we understand the experiences of a baby in utero. If we go back to this slide here, for pre-verbal children, it's very difficult sometimes to understand how they're feeling, how they're sleeping, if they're experiencing nightmares, if they're having physical symptoms such as tummy aches. How do we know their lived experience? Because they can't tell us. And that's in utero, we can't even observe that baby very often. What we need to understand, particularly where domestic abuse is a factor, is are they exposed to high levels of cortisol or heightened levels of cortisol over a prolonged period of time? So is this expectant mother experiencing prolonged stress, anxiety, all of those feelings that would result in cortisol being released? We also know from research that where there is high levels of cortisol, that reduces the placenta's ability to filter out toxins. So if you've got a mother who or an expectant mother who's experiencing things like domestic abuse that's causing high levels of stress, and there's substance misuse or smoking happening there, the toxins from those substances will be higher as a result of that cortisol, reducing the placenta's ability to filter out those toxins. And for those of you who may be familiar with Karen Treisman, she talks about babies marinating in these toxic substances of cortisol and other substances. We also need to think about what that baby hears from their outside world, and the point at which a baby can hear the external world is not a given. There's lots of different research out there, but we do know that whilst the baby is still in utero, they are able to hear what's happening in the outside world. Do they hear lots of shouting and arguing and crying, or do they hear calm voices? Because actually, if they're hearing lots of shouting, arguing and crying, that tells them that the outside world is a very scary place, and when they move into that outside world, they need to be alert. Are they at risk of physical harm if the violence is aimed at the abdomen as well, is something that we need to understand if we're looking at domestic abuse in the pregnancy. And then once the baby's born, they're at their most vulnerable and they are solely reliant on their caregivers. Babies cannot keep themselves alive. And if we look at the number of under ones who are referred to the panel that we spoke about earlier for cases of harm, it's really significant. If there are concerns around emotional regulation in either of the caregivers, we need to consider the risk of non-accidental head injury or abusive head trauma. They're two terms that mean the same thing. Non-accidental head injury is very often used within social care, and abusive head trauma is the term that's very often used within health, but they mean the same thing. And this is the biggest reason for babies dying and accounted for 38% of all serious incidents that were reported to the Child Safeguarding Review panel in 2020. So we know that emotional regulation and that lack of ability to emotionally regulate and living under significant stress is a real risk factor there. So we need to be aware of that. And exposure to domestic abuse, particularly within the first 2 years of life, appears to be especially harmful. So those first 2 years of life, if a child is exposed to domestic abuse during that period, the trauma is expected to be more significant than later on, because they are so vulnerable because of the rapid period of brain development during that time and the impact that it would have on that. And their kind of reliance on being able to co-regulate with a caregiver and all of those factors that make babies vulnerable means that actually they're more at risk of the negative impacts of domestic abuse during that period as well. And thinking about the impact on relationships, so domestic abuse undermines a child's basic need for security and for safety. They can't get that from their home environment if they're living with domestic abuse. Things are unpredictable, things are scary, and things don't feel safe for them. Domestic abuse can cause confusing relationships with parents. So children might not be able to develop a strong bond with their parents or carers. They might have a poor attachment, particularly if we think about the impact for that victim within the relationship. And as I said earlier, the emotional toll that domestic abuse takes, parents very often become, the victim very often becomes preoccupied, first of all, with the needs of the perpetrator, with trying to preempt any issues that may come up and prevent an incident of domestic abuse in a way to protect themselves and their children. And just living with the impact of that and being traumatized themselves means that they're not able to be emotionally available in a way that their child needs them to be. So we can see some really significant impact on the bond and attachment. We also know that for some victims, because if the perpetrator is a biological parent, they can have physical features that are similar to that perpetrator. So again, it can cause that victim to be re-traumatized just by seeing their child, if or certain facial expressions and mannerisms, if they're similar to that perpetrator, it can re-traumatize the parent and prevent them from bonding in a way that we would want for a parent and child to be able to bond. There might be lots of worries about parents separating and divorcing. The hope that an abused parent will leave for safety reasons, and they might be afraid of their parents. We know that for some victims, they run a particularly strict household, again, to try and reduce the likelihood of an incident occurring. If that perpetrator has very specific ideas about routine and cleanliness and tidiness of a home, they might not be allowed to do craft activities, for example, and that's something that we see quite a lot with families that come to our recovery group, that this is the first time they've been able to do these messy activities. And teenagers might worry that they're being raised in an abusive environment will affect their own future relationships, and that was raised as a point in the chat through the feedback, that actually children who've lived with domestic abuse and are victims as a child are more likely to then enter an abusive relationship. And again, if we think about trauma and the impact of ACEs on children, and then their ability to form relationships, their idea of self-worth and all of those things, we can see how that could contribute to them not entering a healthy relationship. And again, if we think about if they've never experienced co-regulation from a parent, that's the way that children learn to regulate, through co-regulation. So if they can't do that, that will again impact on their ability to have and form healthy relationships going forward. As I said, it really is a whistle-stop tour, and this is just really a summary of some of the things that we've talked about. So domestic abuse has a significant and profound impact on babies, children and young people. We really need to recognise that. They don't just witness domestic abuse, they experience it and are classified as victims in their own right. And experiencing domestic abuse is a form of child abuse. Having said all of that, with the right support at the right time, babies, children and young people can recover from the impact of domestic abuse. The NSPCC are calling on the government to fund essential recovery services, as well as scaling up our own evidence-based recovery service. So the government are funding residential services, so refuge type support, housing support, but actually the community services and that recovery support through community services, the funding isn't there for that at the moment. So we continue to lobby for that. Because we really recognise the importance for children in terms of their ability to recover from their experiences. There is hope there, but they do need the right support at the right time to be able to recover from their experiences. So what supports a child's recovery? The first thing to note is that a child cannot recover from trauma that's ongoing. If they're still experiencing it, they can't recover from it. So recovery can only begin when that trauma has ended, or when that kind of unsafe experience, in this case domestic abuse, has ended. And we know that it's not just a case of that relationship ending means that the domestic abuse ends. We know post-separation abuse is really significant for many families, so children can't recover until that domestic abuse has ended. A child's recovery is better if a non-abusing parent or carer is part of their recovery journey. They need that support from somebody else, and the best person to do that is a non-abusing parent or carer who's going to be there for them day in, day out. And children know that they've experienced what they've experienced, but they can't always verbalize it or make sense of it. So the experience is there, but the understanding to make sense of it isn't always there. And so they can't always put those pieces of the jigsaw together. So we need to support them to do those things. And every child's recovery journey will be unique. So the recovery support that we offer at the NSPCC, and as we mentioned in kind of our intros, Wendy manages the scale up of domestic abuse recovering together. So it's a service that we deliver within our own NSPCC hubs, in all of them except our Northern Ireland hub, and we also deliver it through, so we offer it to partners both in local authorities and charities. So it may well be delivered in the areas that you're working in. It might just not be the NSPCC that runs that. So what is domestic abuse recovering together, or DART as we call it? It's an evaluated evidence-based programme, and it's had 2 significant impact evaluations undertaken on it. And it is based on some research from 2002. So 20 years ago, this piece of research was done by Mullender, and the NSPCC began to develop DART in 2005, which is why this research is so old, because it's a service that's been running for a long time now. And the research from 2002 told us that children recover better if the non-abusing parent is supportive, that mothers often underestimate the level of harm that's caused to their child through the domestic abuse. Mothers and children often struggle to talk about their experiences and address the domestic abuse, and the mother and child relationship is often damaged by abuse. So that those 4 things underpin the recovery service that we run.
Yeah, so DART is a 10-week programme. It's run, weekly for 10 consecutive weeks. The sessions are split into mixed group work with the mother and child, and then the children and mums actually separate and do some group work on their own, and then come back at the end of the session. Each session actually kind of lasts for 2 hours in total. It's actually only for mothers and children, as Sophie said at the start of the presentation, because it's based and evidenced on the Duluth model, which is obviously between the male and female dynamic. So it hasn't been evaluated for either same-sex couples or for male victims of domestic abuse. The mums need to be in the right space to actually take part in DART, because it's all about the children, and the mums need to be there to be able to work with the children and support the children through their feelings and emotions. So we often recommend, ideally, that a mum is in a good space and has already gone through some other programme herself, so that she's in a position to be able to support her child during this experience. The children it's aimed at and evidence for are aged between 7 and 14, and we promote them doing that age appropriate. So you would group those ages in 7 to 10 or 11 to 14, or in some cases, some of our external sites just do ones for the older teenagers, like the 13, 14-year-olds, because the difference in ages can obviously have an impact as well. Sadly, it can only be done with small groups. So there's only really, we recommend 5 families at a time, and you need 4 facilitators, because you need 2 people to be able to go into the mums group and 2 people to be able to go into the children's group. So it's quite an intense programme in terms of not only the subject matters, but also the resources associated with it. The first 6 sessions are all about understanding for the children and for the mums what they've been through, and especially for the mums to understand the impact, as we've been talking about that, this whole session. Mums really underestimate often the impact that this has had on their children. So they really get to grips with that and understand it. And often for the children, it's the first time that they've been in a safe space where they've actually been able to talk about it and encouraged to talk about it. So from that, the last 4 sessions, so sessions 7 to 10, are all about really looking forward to the future and positively moving forward on. So that's the kind of whole process of DART. So how we know it works. We've done two studies on DART. One was back in 2016 about the impact, and that was done on our own NSPCC kind of sites that were running DART at the time. And back in 2021, we also published evidence based on our external sites. Both of them were really encouraging, and actually our external sites came out slightly better in some of the feedback, which was brilliant. But we know it works not only as a NSPCC product internally, but externally as well. So we found that it achieved over 62% of mothers with low self-esteem before attending DART reported substantially improved levels of self-esteem after completing DART. 88% of children who found their mums struggled to show them any affection actually reported substantial improvements in their relationships with their mothers. And over half of children, actually 51%, with high or moderate behavioural and emotional difficulties actually reported lower levels of need following the completion of DART. And what a lot of our sites do, they get their mums and their children to actually write letters afterwards to future kind of people that are coming to DART. And if you just really listen to some of those, you can see the impact alone on what actually happens during the sessions. So it's really encouraging.
And that final point on over half of children. So this is just children who had high or moderate behavioural and emotional difficulties at the start of the group. Some had lower than that, and at the start of the group, so at the end of the group they stayed the same. They were still within that lower level of need, and we have been asked, why was it not more than half? But actually, when we think about the complexities of domestic abuse and the impact of the trauma, 10 weeks isn't going to be enough for everybody, and this is just the start of the journey for many of them. So for the majority of the children, there were reductions in the levels of need, but for some of them it didn't take them into that lower level of need. They were still remained in that high or moderate, and we then needed to look at other support for them moving forward. And this is what families told us, and I won't read through each of them, but I just want to pull out a couple of points. So my child is happier now and is able to express his emotions. The experience has helped my son a great deal and was also fun for him to do. I feel I and my daughter have learnt a lot coming here, and we've become closer and understand each other much more. The next couple of slides that I'm just going to run through are helpline numbers. So I'm going to pop them onto the screen and just let you take a minute. You can either, if you've got a phone, you can take a photo of them. I know this is being recorded, or you can take a screenshot as well. So these are the NSPCC and Childline contact details. Again, if you just pop NSPCC into Google, you will find all of this information online. Or any search engine, this information will come up. But both of them have a phone number, and then the helpline has an email address, and Childline children can chat on there as kind of a live chat if they want to, and there's an awful lot of information on Childline website as well. These are some more helplines that are domestic abuse specific. Just leave that up there for a few seconds. And one final slide for anyone who's joining us from Scotland or Northern Ireland. And I would say if there was anything on there that you wanted to have a look at and you didn't manage to make a note of, if you go on gov.uk website, on their domestic abuse, how to get help, all of those are on there. So you'll be able to find all of those numbers on there. So do make a note of www.gov.uk guidance, domestic abuse, how to get help. And there's all of the support numbers on there that are on these slides. Okay, time to move into questions. And just while people are taking a moment to put their questions into the chat or think about whether they're going to be brave enough to put their hand up, I'm just going to take a moment to read out one of the letters that Wendy mentioned earlier. So this was from a mum who attended a group, and she'd written this for future mothers. And she put, "Hi, if you're reading this, then I guess you're sat with one of the guys from Dart. Here's just a few words to say. If you're being offered a place on the group, don't turn it down. Grab it with both hands. I thought at the beginning that they couldn't do anything for me and my family that hadn't already been done, but I was so wrong. My life has totally turned around. My children are happy. I smile and laugh. Something I thought I would never do again. The staff are the most amazing people I've met in a long time, and now my time is done, I'm going to really miss them. Good luck and enjoy yourself." And I think it's just so powerful to hear those words from a mum herself who's experienced that recovery support. It gives us hope because there is such a significant impact of domestic abuse, but we know with the right recovery at the right time, children can get there and we can make a difference for them. So I will hand over to David now.
Thanks, Sophie. Thanks, Wendy. Lots to think over there. I'm sure some questions that have already come through either on the chat or they came to me directly are in relation to the DART program that you were just talking about. So I guess that makes sense, and that's sort of fresh in people's minds. To try and sort of draw them together, because there were a number of different questions. So I suppose there's two sort of main ones really. One is about how people can access the DART program. I can see, Wendy, you've just put an email address in there, but if there's anything else you want to say about the availability of DART in Cardiff, in South Wales, in Wales generally, sort of how people refer, you know, what's the waiting list like, is there a cost, so people are sort of interested in the logistics. Okay. And then more generally, there's a question around, you mentioned that DART sort of based on the Duluth model, looking at sort of heterosexual, you know, sort of male-female partnerships. What's your thoughts on sort of expanding it to, you know, other types of couples, you know, whether it's same-sex or male victims, you know, what's the sort of thinking around that? So two sorts of questions there, if you could sort of respond to both.
So do you want to do that last one first, and then I'll talk about the DART in a bit more detail?
So in terms of kind of expanding that, I think there are lots of support services out there for non-heterosexual relationships, same-sex couples, for male victims as well. And I think there's an absolute need for that support. At the NSPCC, we haven't developed anything around that. What we tend to do is signpost to those other specialist services that are out there. There is a need for more, as with all services, there is a need for more of those. And I think DART's a great kind of basis to work from. But at the moment, the NSPCC is focusing on two very specific themes. And this change happened around about 3 years ago now. So we focus on developing services in the child sexual abuse area and the early years, so pre-birth up to 5. So at the moment we haven't got the resource essentially, and that's the only reason we've not looked into doing that, because there's certainly a recognition from everybody working within the NSPCC that need is there, and the landscape has changed an awful lot since we developed that it began back in 2005, and we know so much more now about the different dynamics of same-sex relationships and domestic abuse, and that female to male perpetrated domestic abuse. So unfortunately we don't have an offer there, but that's not because we don't recognise there's a need.
Yeah, and then we've got 7, if I'm right, hubs actually delivering DART across the UK. We've also got 25 external sites, and they're a mixture of small charities through to local authorities. I noticed that somebody put in there that kind of most in the chat that most local authorities run DART. I'm afraid that isn't the case. There are a number of local authorities that do, Islington for one, St Helens for another, but we do have a list of organisations. If anyone's interested in if DART is available in their area, please don't hesitate to email the DART inquiries email, and we can let you know specifics. In Wales specifically, you do have one which is in North Wales, and they've agreed that I can mention them. So that's DASU, the Domestic Abuse Safety Unit. So they run DART and are continuing to do so. We are always signing up new organisations. So if anyone is interested, please again, just let me know. There are cost implications because there's we run DART as a licensed programme. So an organisation is trained and licensed for 3 years to run the programme. So there's a whole implementation and support package which I run for all of our DART sites. We have a community of practice, a couple of events each year, and ongoing support really from when you start the delivery and service and ongoing. So yeah, I think, have I answered every single question there?
There was a question about Cardiff. So our NSPCC hub in Cardiff will be running DART. So they've had their training. They haven't run it yet, but I know they are working towards, last I heard, a September group. So DART tends to run in term time because it's for one mum and one child. So it's much easier to run when siblings are at school because it's a group. You would never really generally get a group that didn't have siblings of school age. So it just makes it much easier for childcare reasons to run it during school term time. And so again, if you have any referrals that you want to make, if you go on NSPCC's website, the contact details for the Cardiff hub are all on there, so do get in touch with them and have a chat. And there's no cost to referring families. We don't charge for families to access the service. I think that was one of the other questions.
Great, thanks both. Hopefully that answers everyone's questions on the sort of logistics, and you talked a little bit about the signposting you can offer for couples who this wouldn't be the right service for. If people want to put up hands, I'm very happy to come to people. You can ask a question. I have got several questions of my own, but I understand it's bad form for the chair to just dominate and ask a list of questions in a row, but I've certainly got some that I will very happily ask. I can't see any hands up at the moment, so I might ask one of mine and then give other people a chance, and then I can see a comment coming into the chat. But I suppose my question was around you talked, I think, really helpfully about the optimistic message that children can and do recover from domestic abuse sort of experiences, and you sort of highlighted the importance of safety first and then sort of followed by recovery. I just wondered if you could, is there anything you could say about what's the evidence around that in terms of recovery? Where does that optimism come from? I suppose what's your what are you drawing on when where that optimistic message comes from, really?
Yeah, so I guess if we look back at some of the information from what DART itself achieved in terms of that recovery, one of the things that we can't evidence through this service is the lifelong impact, because we with these studies, certainly with the first study from 2016, we did go back after 6 months, and those changes were sustained in that 6 month period. But then that was where the research ended, and we didn't even do the 6 month post check when we did the scale up impact study, because the sites that we worked with just didn't have the resource to do that. So that does kind of limit that in terms of evidence to say we don't know what these children then, what the difference it made for them lifelong, and that would be something really interesting to look at. But there is a lot of research out there when we just look at kind of just recovery generally, and that impact of recovery at the right time to overcome some of those challenges. What we can't do is if you think about the impact on the brain, and kind of go back to those early days, but there's more and more emerging evidence that the brain is more kind of transformable than was thought before, and that recovery later on can happen. And we know certainly within teenage years the brain kind of rebuilds itself through adolescence. So again, that is a real time of opportunity there, in terms of the adolescent period where that brain kind of rebuilds itself.
Yeah, I think that long term, like you say, that long term stuff would be great, wouldn't it, to get some hands on some of that. But actually, you know, if you look at things like self-esteem, that's an outcome worth having at any time. You know, whatever the knock-on effect of that is, it's worth having as an outcome, even in the short term, isn't it?
Yeah.
I would have thought. A comment from Laura saying how helpful it was. She's doing some work herself in a doctoral study looking at ideas around trauma and resilience. So she's going to be using some of your references and drawing on some of the things you've talked about. So that's really helpful to see.
Asked my questions in the chat, but I live in West Wales, but I actually work in East Talbot. So I'm just wondering, is Cardiff the closest area that we can access the hub?
Yeah.
And would that be open to East Talbot then, or is it just the Cardiff area?
So one of the things that we've looked at since the pandemic is all of our NSPCC services and which of them can be virtually delivered and which can't. And DART can't be safely delivered virtually because of that recovery element and that joint element of it. So it very much depends on the geographical distance, and I don't know the geographical difference, I'm afraid.
About 33 miles.
And that's probably too much for our staff in reality. But there's no reason you couldn't ring them up and have a chat with them about that. Absolutely, I would recommend that you just kind of gave them a call and had a chat, because there are other services that they offer that are virtual, so they can offer them more widely. So you might be interested in some of those. So pregnancy in mind, for example.
Okay, thank you.
Great, thanks, Fiona. Yeah, some more positive comments. Just people saying thank you. They're having to leave. You know, meetings coming up and things like that. Monday being a busy day, of course. But people saying thank you and they appreciate it.
I've just put on the helpline this slide again because there's Gallup there for lesbian, gay and bisexual and transgender people, and the men's advice helpline. So if you are working with victims who kind of don't fit into our female victim, male perpetrator box for DART, they're the ones that will know and have a much better idea of what provision is out there nationally and potentially locally as well. So do make a note of those if you're working with any families that you would want to reference for those.
There's a question in the chat about providing or signposting services for victims, for people who are going through domestic abuse proceedings. So that's the question in the chat. I don't know if one of you can see that and help us.
Yeah, so that's not something that we offer at the NSPCC. We work with families who've experienced that and who plan to go through. I mean, I'm assuming that means criminal proceedings rather than looking at kind of contact arrangement proceedings. We would avoid offering the domestic abuse recovery service to families who are in the process of going through criminal proceedings, just because of the potential impact that can have on things like the credibility of evidence that might be given if there's a suggestion that they've been influenced by others' experiences that are shared on the group and things like that. But we absolutely would signpost onto other local services rather than being able to offer that specialist support ourselves.
Good question about the slides. Is the presentation, you know, can people have access to the slides? I know the recording will be on the ExChange website. I don't want to comment on the slides as they're not mine. So.
I'm happy to share them, yeah.
Fab. So the slides should be available on the ExChange website alongside the recording, you know, once we've had a chance to edit the recording. Right. Just to cover, yeah, criminal proceedings, but also in family court. So, you know, private hearings around non-molestation orders, that kind of thing. But I think your answer covers both types, but it sounds good. Yeah, great. Please do continue to ask some questions. We've got a few minutes left if people need to go. Absolutely understand. Thanks everyone for coming. It's been a really interesting presentation. I was listening along in the background as well. So thanks again to Sophie and Wendy for your time, for your expertise this morning. Much appreciated. Some really helpful resources and links and all those kind of things that you shared. Really useful to know. And I just come back to that optimistic message. You know, that's the thing that stood out for me, that optimistic message that, of course, you started off with some figures and facts about prevalence and incidence, which are sort of horrifying. Even though we expect them, you start seeing them in, you know, raw numbers, it's horrifying, but equally the optimistic message that families do recover and children do go on to rebuild their self-esteem and confidence and relationships with their parents. So, really useful, actually, I think, to emphasise that.